When I have the opportunity and the privilege to speak to dental students, what I tell them is that they are the front line for protecting their patients from oral cancer. It's a rare disease, but they need to have a high level of suspicion. Every patient that they see, they need to examine their neck, look in the mouth, and if there's a concerning area, they need to refer that patient for an evaluation and biopsy.
As dentists, as dental students, it's very important when a patient comes in to perform a visual and tactile exam of the oral cavity, looking for any lymph nodes, abnormal lymph nodes, and then you go inside the mouth. And during dental training, you're taught what is normal, and so anything that deviates from normal, you have to document and decide, well, what's going on.
One of my favorite quotes that I give to students all the time: remember, there's a person attached to those teeth. Because what happens is students get so focused on the teeth that they don't look around at the rest of the tissue and do a proper extraoral and intraoral exam. And it all starts with diagnosis, early detection. No two cancers really look alike, and they shouldn't think that, oh well, it didn't look like that, it can't be a cancer.
So the beauty of our Oral Cancer Center here at NYU College of Dentistry is that we have a number of specialists that all play a part in the multidisciplinary treatment and management of these patient populations. One is the oral and maxillofacial pathologist, and they're very important because when we take a biopsy, that tissue is sent to the pathologist.
No diagnosis can be made without a biopsy, and a tissue biopsy is the gold standard of diagnosis. Tissue in the mouth is three-dimensional, so that doesn't always translate well onto the slide. So that can make it very difficult to determine whether it's part of the cut or there is actual infiltration. So what we do is we consult with other pathologists, and we're very fortunate here at this large institution to have multiple oral pathologists. So whenever there is some uncertainty, we have other people and other pathologists to give second opinions and consult with, which we often do before we sign out any malignancy.
So trying to get these patients, working to get these patients where they're restored to health is an enormous challenge, and the challenge is greatest for the patient. It involves dentists who need to restore their teeth, and we often work with a maxillofacial prosthodontist who has expertise in replacing both hard and soft tissues. What's unique about the NYU Oral Cancer Center, we've been able to get those individuals all working together.
I think many of the dentists themselves don't know what the existence of the maxillofacial prosthodontist and what they can do. So my job here is to make sure that I fabricate prosthesis that's going to allow the patients to be able to do all these normal things that we do every day, and then they are able to heal as fast as they can. Having the coherent team is super important. So it's not the amount of time or how many communications that we actually exchange between other team members, but rather like, are we communicating efficiently and effectively for the patients to be able to provide the right type of care at the right time. We need more of a maxillofacial prosthodontist for managing this type of patients.
In a lifetime or in a career, in a 30-year career, a dentist is not going to come across many cancers. But if you're looking, then you can really make an incredible difference to that patient's life.